Yep, good to go.
Okay, praise the Lord, everybody. It's a joy to welcome you to the Geert Vanden Bossche interview, an interview we have been trying to pin down for many, many moons. And it's wonderful to, on the penultimate day of the year, to be able to come and bring to you this awesome interview. Let me just give you some quick background before I introduce Dr. Vanden Bossche. Many of you know, any of you who have been following my ministry over the last 4 or 5 months. Just give you some quick background before I introduce Dr. Vanden Bossche. Yeah, we have come to understand that I did a 24-minute clip that went globally viral and has had millions of views. And somebody shortened the clip into 2 parts, and one of the parts was dealing with viral immune escape. That one went even more viral. And what I was attempting to do was explain Dr. Geert Vanden Bosche's theory, or his model of viral immune escape, and how it would affect the world in terms of mass vaccination during the time of a pandemic. Well, I am glad to say that we finally have been able to host Dr. Vanden Bossche. He is here with us this morning. And let me just tell you very quickly about his background. We want to give him maximum time to speak today because there's so much he brings to the table. Dr. Vanden Bossche is a DVM. He has a DVM, which is a doctorate in veterinary medicine, and he's also a PhD in virology. But beyond his qualifications, I want you to understand that I consider him to be the most experienced vaccinologist in the world. He has worked at some of the major pharmaceutical companies, GSK Biologicals being one of them. He has worked at Gavi, the Global Alliance for Vaccines and Immunization. He has worked at the Bill and Melinda Gates Foundation, and he has also been an advisor to the WHO on their Ebola vaccine protocols. He is a noted global figure. And for a man of this stature and a vaccinologist of this expertise, to lend his voice to the claims that mass vaccination needs to be stopped is phenomenal. I just want to read a statement that Dr. Vanden Bossche made in March of 2021. He said at the beginning of a proposal, immediate cancellation of all ongoing COVID-19 mass vaccination campaigns should now become the most acute health emergency of international concern. Let me go a little further. And he says this in his letter, that this letter was written to, he says this: Geert Vanden Bossche, DVM, PhD, independent virologist and vaccine expert, formerly employed at Gavi and the Bill and Melinda Gates Foundation. To all authorities, scientists, and experts around the world to whom this concerns, the entire world population. I'm just going to read a few clips from this, and then I'm going to turn you over to Dr. Vanden Bossche. I am all but an anti-vaxxer. As a scientist, I do not usually appeal to any platform of this kind to make a stand on vaccine-related topics. As a dedicated virologist and vaccine expert, I only make an exception when health authorities allow vaccines to be administered in ways that threaten public health. Most certainly, when scientific evidence is being ignored. The present extremely critical situation forces me to spread this emergency call. As the unprecedented extent of human intervention in the COVID-19 pandemic is now at risk of resulting in a global catastrophe without equal, this call cannot sound loudly and strongly enough. And finally, as stated, I am not against vaccination. On the contrary, I can assure you that each of the current vaccines have been designed, developed, and manufactured by brilliant and competent scientists. However, this type of prophylactic vaccines are completely inappropriate and even highly dangerous when used in mass vaccination campaigns during a viral pandemic. Vaccinologists, scientists, and clinicians are blinded by the positive short-term effects in individual patients, but don't seem to bother about the disastrous consequences for global health. Unless I am scientifically proven wrong, it is difficult to understand how current human interventions will prevent circulating variants from turning into a wild monster. Those are the 2 opening paragraphs of Dr. Vanden Bosche's letter to the world. Dr. Vanden Bossche, you have made an impression. You have become a legend around the globe. And I'd just like to turn over to you to say a few things more about yourself, maybe, and lead the discussion from there.
Yeah, well, thanks for having me, and thanks for the kind introduction. And it's also been very helpful that you send me a few questions in advance. Well, of course, people can read about my background on the website, etc. But I think the one thing that I would like to say is that a pandemic is very, very complex. There is many fields involved. There is a lot of knowledge involved in order to be able to understand a pandemic. It's not just about the virus. So it's not just about virology. It's also about, of course, immunology. It's about vaccines, it's about evolutionary biology, it's about epidemiology, etc. And I'm always saying, I am not the world expert in every single of these fields, but I have touched upon many of these fields in my career. And that has been very, very useful in order for me to understand what is going on and what is the impact of human intervention on this pandemic. Because in fact, I always compare this to a puzzle. It is complex, there are several different pieces, and one should be able to put these pieces of the puzzle together. And that is really what I consider to be the challenge early on in this pandemic, because there were so many things that were not understood, badly understood, and that needed to be understood, of course, because before you take this decision of doing mass vaccination on a global scale, in fact, I mean, you cannot afford this without understanding really every single detail of the pandemic. And therefore, I'm always saying, you cannot afford doing this type of interventions, if you leave any stone unturned. Because if things are not well understood, and you do this type of mass intervention at a global scale, then there is a high likelihood that if you're doing something wrong, that is, you're simply going to turn this into a catastrophe. And I would say the value that I think, in all modesty, that I've added to this is that I had an opportunity during my career to familiarize myself with the key fields, the key disciplines that are involved in this pandemic, that are really required in order for somebody to understand the evolutionary dynamics of this pandemic, and also to assess what is the impact on our immune system and how do things evolve, because it's very, very clear that this is not a static phenomenon, it's a dynamic phenomenon. And that also explains why the results that we are seeing or that have been observed in clinical studies are not representative of what is happening, let's say, in the population at large. And the reason is that during a clinical study, this is limited in time, and these studies, the current studies have been particularly short, have just been conducted for a number of months. That is one thing. The setting is also well defined. The type of people who get enrolled in this study is also well defined due to the eligibility criteria. And when you see the efficacy data, then you have to be very cautious, because you know that you cannot extrapolate this to the whole population. If you have a pandemic going on in a population, well, first of all, that has always been what I've been saying since the very beginning. If you put the virus under massive pressure because you are going to vaccinate large cohorts of people with a vaccine that is not capable of limiting or cutting the spread of the virus, then you're going to have a phenomenon that we call immune escape, where the virus is going to select more infectious variants. So that is a phenomenon that you don't observe during a clinical study. The fact that there is an evolution of the virus, and we all know we started with a pandemic, the Wuhan strain, and the pandemic that we are seeing right now is completely different. We had Alpha, Beta, Gamma, Delta, now Omicron.
That's right.
So this evolution is not something that you observe during a clinical study. On the other hand, also on the part of the host, the immune system, there is a number of changes that are happening that you don't see during a clinical study. For example, we now see that the innate immune system of people who get regularly exposed to the virus without being vaccinated gets better and better trained. So we see that unvaccinated people, because they get regularly exposed to the virus, are getting less and less illness. And we see fewer cases of disease in these people. So to an extent, even if we look at the data published by Public Health England, that we, in some age groups, we are now seeing negative vaccine efficacy data. So that means that the rates of cases, the number of cases in the non-vaccinated people are lower than in the vaccinees. That is what gives you a negative vaccine effectiveness number. So all these dynamics are very particular for the population, and this is a situation that is completely different from the clinical studies. And that is also the reason why we continuously see that, for example, the criteria for efficacy are changing. So the authorities are putting the bar lower and lower. Initially, these vaccines would yield herd immunity, then they would diminish the transmission, then they would protect against disease, then later on they would only protect against severe disease or death. And basically, this shift in the criteria is nothing else than reflecting, in fact, the evolution of the virus and the evolution of the immune system at the population level. And so these are all things that have been completely ignored. So authorities and experts have largely ignored the impact of mass vaccination and the result of that, of population level immune pressure on the evolutionary capacity of the virus, and also have largely ignored the impact of mass vaccination on the human immune system at the population level. So if you ignore this, it's very, very clear that you can never make a prediction with regard to where this pandemic is going, because people look at all these curves, like I'm always saying, like, financial people are looking at stock markets. So it's easy to say when a curve is about to reach the peak, it's easy to say, well, it will probably decline. And when it has declined and you see that the peak is raising again in neighborhood countries, for example, it's easy to say, well, we expect a next wave. But that is completely useless. And the result of that is that, as I have been saying many months ago already, that the pandemic is not understood, which is very, very dangerous, especially if you plan interventions, at a massive scale. And it is certainly not under control. It is completely out of control. So for the time being, I'll stop there. There is so many things to say. I think you will certainly like to ask me questions about what is going on right now with Omicron, etc., etc. But
Correct.
I leave it up to you to ask questions that are helpful, or that you want to ask me, because they are very relevant for your content.
Yes.
If I may just ask them to make Dr. Vanden Bossche. I am glad you pointed out the major distinction between clinical studies and population dynamics. Very important, and I hope some of our government leaders are listening. You also mentioned that we need to be able to predict the pandemic and be proactive toward it, or we will always be behind it. I wanted you to explain one thing for me. You mentioned the evolutionary pressure on the virus, and much of our audience come from a Christian background, and I want them to understand you're not talking about macroevolution, but you're talking about the development of the virus as a result of immune selection pressure. Could you just amplify that just a little before we go on?
Yeah, well, I'm getting so used to this notion that I sometimes forget to explain people. Yeah, it has been, in fact, the key message of mine since the very beginning. I think people simply need to understand that whenever you are dealing with a microorganism that has the capability of mutating, So we know, for example, SARS-CoV-2, like many other viruses, are mutable or even highly mutable. So if you have a microorganism that can easily insert mutations, and you put that microorganism under pressure, for example, pressure could come from, let's say, you would culture this microorganism in a certain medium and you would change the composition of that medium. This microorganism may not like this. So it is like you're putting a certain pressure on this microorganism by putting it in an unfavorable environment, a composition that is not normal or that is not the best for this microorganism. Could also be an unfavorable temperature. Let's say you would normally cultivate this virus or do a culture at 37 degrees, and all of a sudden you would raise the temperature of that culture medium from 37 degrees to 38 degrees. Well, that will be an obstacle to this virus. It will be an unfavorable environment. And hence you could think, well, the microorganism is going to die because these are unfavorable conditions. Yes, this would probably be the case if it were not, that the virus is always mutating and it produces a number of several different mutants. And some of these mutants will have the capacity to overcome this unfavorable environment, to overcome the obstacle that the parental strain is facing. So, for example, here, when we're talking about the pandemic, what is the obstacle and what is the unfavorable condition? Well, the unfavorable condition is the fact that the population, and that is the reason or the consequence of mass vaccination, a large chunk of the population is building up an immune pressure, because when you vaccinate people, of course, they are going to mount antibodies. But these antibodies are not sufficient to prevent the infection or to prevent the transmission of the virus. So that means the virus can still, to some extent, replicate. It will also produce mutants. And as a matter of fact, some of these mutants will be capable to overcome the population level immune pressure. And of course, now these mutants, they all of a sudden gain a competitive advantage towards the parental strain because they are able to replicate and to transmit in this unfavorable environment, whereas this is now becoming much, much more difficult for the parental strain. So that means that these more infectious variants are now going to be able to replicate on a background of high immune pressure. And since as many people get mass vaccinated, the likelihood that such an infectious, a more infectious variant get transmitted to somebody else who got also vaccinated and who is offering the same competitive advantage to this more infectious strain, the more that happens, the more the viral population is going to be enriched in this more infectious variant, so that in fact, at the end of the day, this more infectious variant will start to dominate and will in fact outcompete the original parental strain. And that is why we see that in countries, especially in countries that have very aggressively implemented this mass vaccination by vaccinating like millions of people within a relatively short time frame, we see that these mass vaccination campaigns or this increase in vaccination rates are accompanied by an increase in infectious cases, because more infectious strains that existed, they existed already before mass vaccination. There is no doubt about it. The only change that has been caused by mass vaccination is that these more infectious strains were all of a sudden now given a competitive advantage, again, because of the generalized immune pressure in the population. And so they became dominant. And when a more infectious strain becomes dominant, the infection rate goes up, of course. And that is what we have been seeing in association with mass vaccination campaigns. And that is why we always say, well, mass vaccination is going to promote the propagation, so the expansion of more infectious variants, and are therefore going to lead to an increase in the infection rate. I hope this clarifies, but please feel free to
excellent.
ask.
Yes,
Yeah.
excellent. That was excellent. Sherwin,
Yeah.
you go ahead.
Yes, thank you.
Thank you, Dr. Vanden Bossche.
Yes, I guess following on from that, I think there's a great interest now around the Omicron variant. So, well, two questions. One, how long, so has the Omicron been around all the time? Or is it a new variant that, as you have said, probably just come to prominence now because of that pressure being put on the virus?
Yeah, well, that's a very good question, and you know, I'm always trying to simplify things in the sense that I know there is a lot of speculation about the origin of this variant, but please bear in mind that we are having already a number of different variants, and maybe people don't realize this, but within each class, I would say, of variant, whether this is beta or delta or even now Omicron, we have a multitude of subvariants. Subvariants that have not exactly the same genetic sequence, but that are still classified, for example, as Omicron or as Delta, because by and large, they have similar phenotypic properties. They have similar characteristics. But as the number of variants and the number of subvariants is continuously increasing, one thing. Secondly, as the infection rates are also increasing, the likelihood that somebody now gets infected by more than one variant at the very same time is also increasing. So we cannot rule out that we have more and more cases where several different variants are recombining within one and the same host and building what we call reassortants. So that means that if reassortants build, you can have all kinds of different properties with regard to resistance to vaccines, the infectiousness, the virulence, etc. Pretty unpredictable. But, and this is important, at any rate, for such a recombinant, let's say, to be able to replicate and to dominate on a background of high infectious or high immune pressure, it must be more infectious, as I just explained previously. And that is certainly a criterion that is completely met by Omicron, because it is, as we know, highly infectious. So in other words, is Omicron something that is completely unexpected? Well, I would say no, it is not, because it is highly infectious, and that is what you would expect as a result of natural selection of a virus that is facing an increasingly high immune pressure from the population. But of course, other characteristics may be very, very different, because we cannot rule out that more and more we are going to see variants that are now in fact reassortants and result from recombination of several different variants within one and the same host. Over.
So I have a question from a friend regarding this. She's vaccine injured, and she's just wondering what impact would the Omicron variant have on her if she was to get infected with the Omicron variant.
So do you mean the clinical impact or on the population level?
No, a clinical impact. This is an individual. She was vaccine injured.
Well,
and she's concerned as what impact will have on her.
Yeah. Well, let me explain my interpretation of this thing, because as I was saying, I've invested a lot of time, as I told you in the introduction, to put the pieces of the puzzle together. And what we are seeing with Omicron is that, first of all, we have a high level of resistance of this virus to the vaccinal antibodies. Of course, we know that some folks have been reporting studies where, so to say, after the third boost, the vaccine would still be efficacious to some extent, at least against Omicron. But don't forget that those data are based on an analysis that has been done within 2 weeks, for example, after the third boost. And we know that vaccines, especially during the first week, can also have a non-specific effect simply by stimulation of innate immunity, for example. So those results for me are not really very meaningful at this point for me. We have also the in vitro data where people do in vitro neutralization assays, but again, that doesn't always correlate well with the neutralization in vivo. So what I think is happening is that Omicron is way more resistant to the vaccinal antibodies than, for example, these first clinical studies after the third boost and the in vitro neutralization assays seem to indicate. And this would not be surprising, as you have heard. There is many mutations, and even already in the receptor binding domain alone, there is at least 10 mutations that are non-synonymous, right? So if you think about it, that this variant is now becoming pretty resistant to the vaccinal antibodies, then that is a very interesting situation. First of all, this would be in line with what I always predicted, that ultimately we would breed variants that become resistant to the vaccinal antibodies. But what is the good news? Well, the good news is that I've always said that vaccinal antibodies have the capacity to outcompete, to some extent, our innate antibodies. So we have innate antibodies that can recognize SARS-CoV-2 virus. And I don't want to make this more complicated than necessary, but people should understand that our innate antibodies that we have really as of birth, and that are not triggered or induced by an encounter by a pathogen or an antigen, these antibodies are directed against certain glycans, certain sugars. And as a matter of fact, these sugars are similar to the sugars that are sitting on the surface, not only of SARS-CoV-2, but of all coronaviruses, and even to some extent on influenza virus. So it's not surprising that these innate antibodies can protect us against SARS-CoV-2 and even all kinds of variants. That is also the most likely explanation for why, at the beginning of the pandemic, healthy people, and especially also children and youngsters, were not getting the disease. They were getting the infection, but they were protected, so to say, because they have a high quantity of these innate antibodies that protect them. So now one has to imagine that if vaccinal antibodies specifically bind to, for example, the spike protein, they bind with relatively high affinity, whereas the innate antibodies recognize the sugars on the virus with a rather low affinity. So that means that when vaccinal antibodies bind to the virus, they can at least to some extent outcompete the innate antibodies. And when that happens, of course, the innate antibodies, they can protect against all variants. You lose this broad protection and you have only a very specific protection, which we know is no longer very functional because the vaccinal antibodies, although they still attach to the spike protein, they have increasingly difficulty to neutralize the virus because these vaccinal antibodies were induced by a vaccine that has the Wuhan spike protein, whereas, of course, the circulating viruses have now, had the Delta and now an Omicron spike protein, which is pretty different. But a point that I wanted to make, and that is very important to understand, is now we have now a situation where these vaccinal antibodies obviously can no longer strongly interact with the virus. That is the reason why we're saying it becomes resistant, or these antibodies have a lot of difficulty to neutralize the virus. So that means that now they are less potent in outcompeting the innate antibodies. So in other words, now that we have resistance or increasing resistance to the vaccinal antibodies, the innate antibodies can again take their place, and they can again bind to the new variant, the Omicron, which is of course resistant to the vaccinal antibodies. And that is, according to my humble opinion, the explanation why this Omicron is pretty mild. Because if you have your innate antibodies binding to the virus, remember, this was the mechanism that ensured mild or even asymptomatic infection at the beginning of the pandemic, thanks to our innate immunity. So if this innate immunity gets now restored in the vaccinees, they had lost it because it was to some extent or to a large extent outcompeted by the vaccinal antibodies. But now the vaccinal antibodies don't bind any longer to the virus. So the innate antibodies that can deal with all kinds of different SARS-CoV-2 variants, even with all coronaviruses, they are now regaining their functionality. And we know that innate immunity can not only protect against disease, but can even protect against infection and can eliminate the virus. So this is the blessing that we are, most likely enjoying right now by a very mysterious situation where, yes, Omicron may be a result of the increasing immune pressure in the population. It became more and more infectious to an extent that it even became resistant to the vaccinal antibodies. But still, thanks to that resistance, the innate immunity can kick in again and prevent disease and to some extent even infection. So this also illustrates a very interesting phenomenon, how powerful nature is. We always said, don't do this mass vaccination. What is protecting people is their innate immunity. So we didn't listen to nature, and we were just playing with the acquired immunity, the type of immunity that you induce through vaccines. And guess what happened? The virus simply developed resistance against this bloody acquired immunity, and that is what brought back the innate immune defense in the form of Omicron. So the only difference is that we are now, in contrast to the situation where we were dealing with the Wuhan strain, that we are now dealing with Omicron, seems to be pretty harmless, like the Wuhan lineage, but it is much more infectious than the Wuhan strain. So it now remains to be seen what this will do, let's say, in the longer term, because I'm a little bit skeptical that when people get exposed to Omicron and they get re-exposed to this very Omicron within a short time frame after their first exposure, that this might lead to, I'm not saying severe disease, but more cases of disease, and that maybe we will shift from mild disease to moderate disease. Because getting reinfected shortly after you got your previous infection may make the disease worse. We have not seen this yet, but we may start to see this in a few weeks from now. So that is something that we don't know right now. Whether this course of the disease that is very mild will be consistent, or whether it will start to evolve. That could be the case, as we have seen. Remember, with the Wuhan strain. So the Wuhan strain at the beginning, no children, no youngsters got the disease whatsoever. And then all of a sudden, we saw these more infectious strains popping up. One of the reasons was, of course, the mass vaccination that made them dominant. And as alpha and beta and gamma came along and became dominant, all of a sudden, what we saw was that now all of a sudden, also younger age groups were getting the disease, were getting ill. Most of the times, not severe illness, so not hospitalization, no deaths, or very, very few, but they got the disease, they got ill, whereas at the beginning of the pandemic, when we had the less infectious Wuhan, this was not the case. And that is why I'm saying, if we are now going to see with the Omicron, is highly infectious, that people get reinfected, and the likelihood is pretty high with Omicron that you get reinfected shortly after you have been infected for the first time. It remains to be seen whether the course of the disease will still be mild. So that is something we don't know. There is a lot of speculation, but I'm not going to speculate because I'm pretty sure that given the high level of infectiousness of Omicron, we will find out pretty soon. So pretty soon, I mean within the next 4 to 6 weeks, maximum 2 months. Over.
Okay, great. So Dr. Nicholas, I believe you have some questions.
Yes, certainly. Dr. Vanden Bossche, a pleasure to meet you, a pleasure to interact with you here. I'm out of Barbados, and you know, we've heard quite a lot concerning this entire matter over the last couple of years. As a matter of fact, I think we'll all agree that you can hardly find medical professionals and scientific persons that can agree for whatever reason. I don't want to speculate into their reason for disagreement. You know, some persons may consider it to have an underlying reason. But the general public, and I speak from the position of a general public person, not knowing all of the terminologies and expertise and so forth. But as a regular person in our community, there has been a lot of concern. There's been a lot of fear, a lot of apprehension concerning the vaccines, period. Our government, of course, in Barbados has been promoting vaccination, vaccination, vaccination. Is coming out of your ears. Everywhere you turn, vaccinate, vaccinate, vaccinate. But nevertheless, we have, as you would know, on a global level, persons have access to significant amounts of information that can conflict each other. And as a result, persons are somewhat confused as to where they stand, what should they do, should they take the Pfizer, should they take the Moderna, should they take the Johnson & Johnson, and if they do, and there are side effects, what type of side effects can we expect? And if there are, what can we do? There seems to be very little coming out of any of our governments within the Caribbean, and I think Dr. McDowell and Steve Sherwin would agree with me, pertaining to what I would call precondition activity. That would be maintaining good diet, you know, taking your intakes of vitamin C, your vitamin D, your zinc, your multivitamins, watching your food intake. And in spite of that, you know, there's nothing being said by our governments pertaining to proper health activity that could prevent. It seems as if even though you are healthy, and even though you're taking all of your vitamins and you're watching your food consumption and so forth, that you have to vaccinate to prevent contracting the disease. Yet, sir, our medical professionals right here in Barbados can't seem to agree on this factor. Some people say that the vaccines prevent you from contracting and prevent you from spreading. But when we look at CDC information, when we look at information from others, it tells us the exact opposite. It doesn't stop you from contracting. It doesn't stop you from spreading. All of these are the conflicting messages that as the general public we're getting. Could you help us sift through some of that information so that we can know, okay, this is what I need to do, or this is what I should do?
Well, yeah, of course, we can definitely help. The problem here is, of course, is the tremendous pressure that is put on people. If it were like people were really completely free in their choices and would not be threatened with losing their jobs or whatever, then we could have a very open discussion, and people would, you know, very, very simply inform themselves and then could make what we call an informed decision. It becomes increasingly difficult when people are, of course, threatened with, for example, you know, losing their jobs and all these other types of pressure that is put on people, because I would say, well, as I just explained, as a matter of fact, and this is not the case for all viral diseases, but for example, coronavirus and influenza virus can be very, very well controlled by our innate immunity. And imagine if somebody would have told you like 2 years ago, we are going to vaccinate, because we know we have from time to time also flu epidemics and pandemics. If somebody would have told you, you know what, we're going to vaccinate all of the population against influenza, including all the children, everybody would say, wait a minute, I mean, when do children really get the disease, influenza disease? Of course, we know with corona, with influenza, children get infected, but this is the first thing people need to realize. Neither influenza nor SARS-CoV-2 are diseases of healthy people, let alone children. So they get infected, but it's not a childhood disease. It's not even a disease of healthy people. People who have no underlying diseases and have a pretty good and healthy lifestyle. Of course, you cannot score 10 everywhere, but on average, well, these people get infected with flu, get infected with coronavirus, can maybe get some mild disease, and worst case, they have to stay in bed for like 2-3 days. What is wrong with being ill? That's not a problem. When you recover, the problem is getting severe illness, hospitalization, and this type of things. Those things we are typically not seeing with these infections, with these viruses in healthy people, so let alone young people. So that's the first thing I wanted to say. And the explanation is what I just explained in very brief terms, that in contrast to some other viruses, our innate antibodies protect very, very well against viruses that have an envelope and that have sugars on this envelope. For example, RSV is another one. Influenza is one, SARS-CoV-2 is one, but all coronaviruses. And our innate antibodies are made in a way that they can recognize sugars, for example, sugars that are exposed on these viruses. So that is the first thing. And then you have to know, and there is a lot of scientific publications about this, that the health of your innate immune system is directly correlated with your overall health status. So it's very, very clear that people who are in good physical and even mental health, and they have a healthy lifestyle, healthy food, do their exercise, have no overweight, well, you know what I'm talking about, and they take maybe some supplements if needed, for example, vitamin D during winter in our countries, right? That there is a correlation between those healthy lifestyle and the functionality of your innate immune system. The third thing that I would like to emphasize, and this is, well, it's not new, but in science, if things get discovered like just 10 years ago, then it takes an awful amount of time till this gets broadly introduced into the community. But it is very well known that, and there is plenty of publications, people will find them on my website, that the innate immune system can also be trained. So what does that mean? That means that if you get regular exposure to the virus, your innate immune system will perform better and better to deal with that virus or with the pathogen. And of course, if we talk about training, the pandemic is an ideal situation to get trained because you get repeatedly exposed to the virus. And I very much like the word training, because sometimes people ask, Geert, what have you been doing to protect yourself? Well, I can tell you, I've been training myself. So what does that mean? If I ask you to lift like, we are always calculating in kilograms, to lift 100 kilogram, up your head, you cannot do this. But if you start with 10 kilogram, and then you increase 20, 30, 40, well, maybe in 6 months, you will lift that 100 kilogram. So that means what I've been doing, and all the folks, in my family, etc., we have been exposing ourselves gradually to the virus in having, at the beginning, limited contacts. If we had some more contact, well, we refrained from having contact for like 1 or 2 weeks. From time to time, we felt like, well, I'm not 100% fit, so I'm going to be a little bit more careful, etc. But now, having had regular contacts, we make sure that we maintain these contacts. I'm certainly not advising people, to go to big gatherings and have frequent and big gatherings, but by staying exposed to the virus. And anyway, you cannot avoid it. If people think they can avoid getting infected by Omicron by wearing masks or social distancing, etc., they're completely wrong. The virus is so highly infectious, but when you get trained, at the end of the day, you can deal with all these variants and even with a relatively high viral load. So that is to say, first of all, the proof is there that the thing that is doing the job here is innate immunity. So people should concentrate, how can I strengthen my innate immunity? I was telling you, make sure you stay in good health. And even for those who are not used to do exercise, etc., etc. Third positive thing, this trained immunity or this innate immunity can get trained. So that means that you can improve the immune defense against the virus by having regular exposure and contact. And that is just fantastic, because it's inevitable that you will get repeatedly exposed. So this being said, of course, for me, it is a complete nonsense to get vaccinated. I do understand that people have so much pressure that then they say, well, which vaccines should we be taking? And then we are talking, of course, about the side effects, okay? And we know there is the mRNA vaccines are way more problematic in terms of side effects. But people should understand that no matter side effects, etc., all of these vaccines, all of the current vaccines, when they are used in mass vaccination campaigns during a pandemic, which is the case right now, they will drive immune escape and ultimately resistance of the virus to the vaccinal antibodies, what we are seeing right now. So, and when there is resistance, I mean, nobody has any benefits, individual benefit, from having taken the vaccine. But that is difficult for people to understand, because this is like a long-term perspective. This is like taking into account the evolution of the virus. And people simply think, well, I take a vaccine and I just want to diminish the likelihood that I'm going to have a side effect. But what people forget, and this is a very important message, is that in contrast to drugs that you take a drug, for example, it's going to be eliminated from your blood. 24 hours, 48 hours, depending, of course, on the half-time of the drug. People do not realize that when you take a vaccine, this is like installing a program, a software on your computer that you can never, ever erase again.
Yes.
This is a program, this is a message to your immune system. It will imprint your immune system, and this memory is there for the rest of your life, which, by the way, is a fantastic thing. If this is the right software that you have installed, it's just fantastic. It will recognize every single bug, every single viral program, for example. This is just fantastic. And that is why I'm saying people who realize the kind of expertise that I have in the vaccine field, and they dare to call me an anti-vaxxer, these are just pea-brain people. These are just unbelievable, because I would say, if you have a virus like measles, which we know is highly infectious, where you cannot have that strong protection from your innate immunity, the virus is going to break through that first line of immune defense immediately. Then in regions, in areas where you have a high risk of epidemics, you should vaccinate the children so that they have already a high level of protective antibodies before they encounter the virus and before you get an outbreak, because it's very, very infectious. It goes very, very fast. But that is a completely different situation from the situation we are in right now. And as I was saying, the example of measles, of course, when you vaccinate, you're going to install that software on your immune system, but that is just fantastic because the antibodies will prevent you from getting measles. But here, the antibodies, they are not preventing the infection because, you know, the antibodies don't match with the virus. And the more we vaccinate, the more the virus is going to escape and the more infectious variants are going to dominate, right? So this, sorry to use this term, but these idiots that pretend that we should vaccinate more and more and larger chunks of the population to stay ahead of the virus. I mean, what are they talking about? The replication cycle of a virus takes like 10, 12 hours. It takes 10, 12 hours before the virus puts a new generation with all the kinds of mutants that are required that the virus can choose from in order to overcome the pressure that we put on the virus, right? So it's just unbelievable. So in other terms, in terms of, can we give very clear advice? Yes, this is my advice, but I know, of course, that people are under tremendous pressure. And then they think, well, at least I will choose a vaccine that does not have these side effects or where the risk is lower. But they should not forget that they are going to install the software program and the virus is escaping. The virus has been escaping all the time since we have started this mass vaccination. You see how the infection rates are going through the roof. And especially, this is very interesting to observe. It's not necessarily the countries that have the highest vaccine coverage rates. It's essentially the countries that have put the highest pressure on the virus. And how do you put a high pressure on the virus? By vaccinating a big part of the population within a very short time frame. So you will see that all this escape and also most of the problems that we are seeing right now is in countries that had a very aggressive vaccination program. For example, Israel. For example, the UK. For example, US.
Yes. Well, Doctor, just if I can prevail on you another perspective or another question. Of course, we know the mortality rate of the virus. I think we would all agree on that in terms of it's quite a killer virus from what we've been observing for whatever the reason. And if you are not recommending mass vaccinations, what are some of the alternatives that we can utilize or we can introduce? It's almost as I go around the country, Barbados, we're a small country. I don't know how familiar you are with our country.
Well, I've never been there, but
you need to come before you go to Trinidad. Well, before you go to Trinidad, you need to come to Barbados.
Oh, really? Yeah.
We have to talk about that.
But it's 166 square miles, 280,000 people. And at current, I was just taking a quick look because you mentioned the vaccination rate. As of today, fully vaccinated persons, I would imagine those are persons that have taken all of the booster aspects and so on, is 66%, 30% unvaccinated and 4% partially vaccinated. Nevertheless, we've gone through 2 years, and I must confess that from a Christian minister's standpoint, we've been trying to grapple with a lot of the stresses and a lot of the side effects of the virus. And people talk about the virus and they talk about the vaccines, but they're not talking about the domestic violence, the child abuse. They're not talking about the sleepless nights and the stress and the depression, the suicidal rates that have increased, and all of these different factors for those persons that have been involved in the whole process. And we've gone through 2 years of that. What could we do different, Doctor, in 2022? I mean, we're at the end of 2021. What could we do different that could
Well,
possibly see us come to the end of this pandemic?
Well, I mean, again, the advice that I will give, I think, is purely based on a scientific understanding of the pandemic. That's one thing. Secondly, it is, I'm sure, very easy and logic to understand. But there are two things. First of all, there is again the fact that, and I will talk very briefly about this. You have heard about this, of course, early treatment and things like this.
Yes.
That there is a very strong opposition from the public health authorities. Can you imagine to implement this? So we were seeing again the same thing where people say, yeah, but I have no choice. I must get the vaccine because otherwise I'm going to lose my job. So here we see the same pressure on preventing, on opposing, on early treatment, for example. So we can give recommendations, and they are based on very sound scientific grounds, but it seems like it's impossible to implement. The second obstacle is, of course, and imagine, this is something people are, forgetting, but it is, of course, critical. We are talking about a pandemic. Per definition, a pandemic is a pan-continental phenomenon. And guess what? Every country, I mean, in Europe, it's crazy. Every country is implementing its own strategy, its own rules, etc. We can only win this fight if we implement, of course, very simple strategies, but that we roll them out, globally. Because, I mean, I've never been to Barbados, but I guess you get many, many tourists, right?
Yes, sir.
So what does it help if you guys implement a very logical, sound, and efficacious strategy to end this damn pandemic when other countries are not doing this and are going to reintroduce all over again all the time? And you guys cannot, nobody, even a big country cannot afford to stay completely isolated. It's killing the economy. It's killing all, social interactions, etc., etc. So, but to your point, what should be done? Well, first of all, as I was saying, or I must say the opposite. I've not been saying this. There is, of course, a number of people, a certain percentage of the population, that do not enjoy a very good health for several different reasons, because, for example, they have underlying diseases, some elderly people who have a weakened immune system, some people who are taking medication that is immune suppressive, etc., etc. But what we know, and again, I don't know how many more publications we still need to have. I don't know how many more times people like Peter McCullough need to give podcasts and even, appear on TV just to tell people how simple this is and how easy this is. And the focus should really be on early treatment, and it's not something exceptional. I mean, if you, that is what I have been doing all the time in the past when, I started sneezing and coughing and not feeling well, etc. I took, some painkillers, some anti-inflammatory drugs. I took some vitamins, etc. And this is so important because we know that at an early stage, and even, like washes, gargling, etc. Don't forget, this is an enveloped virus. It is so vulnerable. This virus, you can kill it. Just look at it, and you kill it almost. So do it early, at an early stage of the disease. You can do so many things to eliminate that virus, in fact, from the local portal of entry. And when you do this, I mean, in over 90% of the cases, I mean, people don't even develop moderate disease. But of course, and I'm sure you have heard this, if all of a sudden the virus or the disease reaches a certain stage, then the nature of the disease is no longer purely viral. It becomes like a cytokine and a hyper-inflammatory phenomenon, right? Where, of course, then it's a different situation, because then you start having very systemic effects. like interference with clotting and a number of organs that are affected. So then it becomes very, very, very difficult. So what public health authorities are telling people right now is almost like, okay, we diagnosed COVID, there is nothing we can do, go home and hopefully you will cure it out. But if not, you have to wait till your lips turn blue and then you can call an ambulance and we will put you on the ventilator. So that is so important to understand that this disease is so easily treatable. And even in a more advanced stage of the disease, we have all the drugs available. They are cheap. They are worldwide, so to say, available, but they cannot be used. And that is just very, very dramatic, because remember, if people are treated in an early stage, they recover from the disease, they contribute to herd immunity. We have not been talking about this, but you know, this is again an easy rule. It is so simple. You can only control a pandemic when you reach herd immunity. If you cannot prevent the transmission of the virus, you will not have herd immunity. You will not reach that. And without herd immunity, you cannot control. It's so easy. This is such an easy rule. So how do you get herd immunity? Herd immunity, there is only two components, two pillars. The first one is the innate immunity. You can deal, your body, your innate immune system deals with the virus in a way that the virus gets eliminated. This is what we call sterilizing immunity. Or you develop the disease, you recover, and you will have very potent, also with a relatively broad spectrum antibodies that will also protect you. And that is how you generate a herd immunity. So even when people get a disease, they recover from it, they will develop herd immunity. The vaccines cannot do this. I was just saying at the beginning, you know, to explain you about the immune escape, etc., that in fact, when you vaccinate a population, what you're doing with a vaccine that cannot prevent infection, you're in fact turning this population into a breeding ground for more infectious variants. So now that is exactly the opposite from, you know, achieving herd immunity, because herd immunity, you know, means that you have diminished the transmission to a level such that the risk for somebody who didn't get immunized at all to catch the virus is so low that it's almost like non-existing. But here we turn the vaccinated population into a breeding ground for more infectious variants. So my background, as you correctly announced, is veterinary medicine. So what we are doing, for example, in veterinary medicine in clinical practice is if we don't have, for example, a vaccine against a problematic disease, for example, a certain parasitic disease, parasitosis, what we would do is, for example, infect a whole herd of cattle with that disease on purpose, with that pathogen. Of course, the cattle will get ill, will get the disease. From the early moment, you know, they develop the disease, you treat them. In case of a parasitic disease, for example, ivermectin. So what happens? Of course, the disease will stop, will be abrogated, but the immune system has had an opportunity to see the pathogen and to develop immunity. So it's even something that is done on purpose. So why on earth can we not, first of all, save lives by treating people in an early stage of the disease, so that there is no burden for our hospitals, and that on top these people contribute to building herd immunity. So you see, it's not a problem of science or the logic not being there. It is so easy. The other thing that I was saying is that to answer your question, what can we do? The other thing that is very important, as I was saying before, I'm a little bit, well, not necessarily skeptical, but cautiously optimistic with regard to Omicron because of the high level of infectiousness. And this high level of infectiousness may exert, this time not immune pressure, but an infectious pressure on our immune system, so that people would become more ill, maybe. But anyway, having a high infectious pressure in the population, a high infection rate is not a good thing, because it is threatening the health of people, also of the non-vaccinated and the vaccinated. So if we could simply reduce that infectious pressure so that we would get back to a situation that is comparable to the situation that we had with the Wuhan strain, where the infection was much less infectious, where the infection rate was much, much lower, and where there was no problem whatsoever for anybody that was in good health, our youngsters, the children, etc. That would be a fantastic thing. So how could we do that? Well, I'm always saying the way to do this is to put, for example, a whole population for only like 6 weeks under an antiviral chemoprophylactic drug. So doing antiviral chemoprophylaxis for just like 6 weeks, and people hate, when we talk about ivermectin, etc. But frankly speaking, I don't care. Any antiviral chemoprophylactic drug that we could administer for like 6 weeks that would enable to dramatically diminish the infectious pressure in the population. And then we can simply have all these unvaccinated people, or people that have now freed up again their innate antibodies because there is resistance to the virus. They can now all contribute to further eliminating the virus through their innate immunity by, of course, eliminating the virus. And this would, of course, contribute to lowering the transmission rate and ultimately arriving to a situation where the pandemic is, so to say, converted into an endemic situation. I'm just always giving the example, and look at the world in data, these curves on the cases, the infectious cases, for example, of the UK, where the 21st of July, Boris Johnson was lifting the lockdown measures, right?
Yes.
Well, what you saw, what was the situation that we had? At that point, there was still a substantial amount of non-vaccinated people, but people were more or less in isolation, right? Yeah. All of a sudden, people could intermingle again, and what you saw was, and look at those curves, after the 21st of July, within 2 weeks, you had a dramatic decrease of the peak. That is why I'm always saying these people who are not vaccinated, who in other words have preserved the functionality of their innate immune system, they serve as vacuum cleaners for the pandemic, because they will eliminate the virus. The innate immune system can do this in this particular case against coronavirus. So if you first diminish the infectious pressure to make sure that these people don't get the disease, and then you just leave these people, in the society, of course, people should have contacts, then you will automatically further diminish the infection rates. And you can see this in countries that right now have still pretty low vaccination rates, or even up to 50% maybe. They have a peak, and then you still see a kind of dramatic decrease of the peak. And that is to a large extent due to the fact that, of course, people who got the disease build antibodies that protect them, but also they still have a substantial amount of people who are uncompletely vaccinated or not vaccinated at all, and can take care of eliminating the virus. When you look at countries that have very high vaccination rates, when they have a peak, you will see a small decrease, and then you have the plateau. The peak never declines back to zero, or back to the initial baseline, I would say. It declines, and then you get on a platform, and the height of this platform is always higher than the platform you had before, the platform that was following, I would say, or the plateau that was following the previous peak. So this is because this population has no longer a capacity for clearing the virus. Who is going to clear this virus? Not the vaccinees, because they can't do this. On the contrary, And so the more we vaccinate people, the more we lose this capacity to get rid of the virus. And that is the dramatic thing. And the more we breed more infectious virus that are, on the contrary, are going to increase the infection rate instead of getting it down.
Dr. Vanden Bossche, your assessment of the situation is excellent, and the solutions you're proffering are excellent as well. If I may, I would like to read a short statement, make an observation, and then ask two quick questions. I'm following on what Dr. Nichols has been asking about, looking to 2022. This is a statement from one of your second major papers. I think the paper is entitled, "Why the Ongoing Mass Vaccination Experiment Drives a Rapid Evolutionary Response of SARS-CoV-2. And the statement is from page 4. It says, "How can they possibly justify mass vaccination campaigns in the light of all the scientific arguments pointing to the high likelihood that these campaigns will only expedite viral resistance to COVID-19 vaccines? Why are the scientists who are bringing all this evidence to the paper not bringing it to the table? How can they predict that this pandemic is going to evolve more problematic, variants of concern, and keep silent? Why don't they set up a forum of independent, knowledgeable experts providing indisputable and unanimously agreed evidence that the rhetoric put forward by the WHO and the national health authorities is scientifically wrong?" That's a statement that you made in one of your papers. Very strong words. And let me just make an observation concerning something you said earlier. I think your assessment of the Omicron variant in terms of what is happening with it, in terms of it generating eventually a resurgence of our innate immune system, I think it underscores the fact that you are saying that a pandemic is a dynamic affair, a dynamic situation that you have to be constantly on top of. And you have been stressing that we need to be doing this sort of predictive things that you are doing right now, in terms of saying that it's possible that the Omicron variant may even go on to cause even further illness. I'm saying all that to ask this. You have continually, I have read your papers, and you mentioned in your speech today that co-infections coupled with the production of recombinants have fueled very, very significant variants. And in one of your papers, you even went as far as to say, if this continues, if the mass vaccination continues, there is a possibility that we can produce what is called a super variant. So I'm asking, as we look to 2022, if the mass vaccination and the immune selection pressure continues unabated, do you see eventually the production of a super variant? Are we there yet, or will we see in 2022 the production of a super variant?
Yeah, that's a very good question, and I'm really happy that you're asking that question, because indeed it needs a little bit of clarification, in the sense that why have I always been saying that if we continue mass vaccination, that this could really become a disaster and lead to a super variant that would do lot more damage than any of the previous variants ever did. So this is, of course, supposing that the public and global health authorities will continue to advise mass vaccination and automatically also adapt their vaccines to the circulating variants. I think we all understand that if the vaccine industry is going to continue these mass vaccinations, they are no longer going to use the Wuhan strain, so to say, but they're going to update their vaccines. So now what is going to happen? And I would like to really explain this in ways that you can clearly understand this, because then you will immediately realize where my warning comes from. So right now, as we were saying, the Omicron has developed Well, if it is not full, it is very substantial resistance against the vaccinal antibodies. So that means we had, particularly in a small domain of the virus called the receptor binding domain. So that is the domain that the virus uses to dock on the receptor of the cell, to get into the cell and to enter into the cell. So we know this is a quite small domain. And we had already a number of mutations in that small domain. Now with Omicron, about 10 new mutations only in this small receptor binding domain. So now you can imagine if we now make a vaccine against Omicron, and these vaccines particularly target the receptor binding domain, then it will be very, very difficult. Of course, these new vaccinal antibodies will perfectly recognize all these different mutations within the receptor binding domain. So now it will become very, very difficult for the virus to find a solution to that if that solution is to be found again within the receptor binding domain, because you could say, well, the virus can come up with another number of mutations within this receptor binding domain. But as I was saying, first of all, the number of mutations has already been relatively high compared to the small size of that receptor binding domain. That is one. The second is, if you are now going to change this receptor binding domain further by inserting additional mutations, then there is a high risk that the structure of that domain will change in a way that it will no longer be able to recognize the receptor on the cell. So there is a much easier way for the virus to circumvent this. And that is simply to insert another mutation, maybe one or two, not in that receptor binding domain, but in a domain outside of the receptor binding domain. So, and what would that mutation do? How would that mutation give the virus a chance to overcome the pressure that we are putting on Omicron by developing and administering a vaccine directed against Omicron? Well, we know that the virus can enter into the cell via different receptors. So the receptor binding domain that I was talking about primarily recognize the AC2 receptor on the cell, right? But we know that the virus can also enter through other receptors on cells. It's just that this is not its preferred way of entering into the cell. Its preferred way is the AC2 receptor. But I can tell you, it only takes the virus maybe one or two mutations in a domain outside of the receptor binding domain to make another receptor on the cell its preferred entry point into the cell. So now when that happens, imagine what happens. You would have, of course, antibodies from the vaccine that still very, very tightly bind, I would say, to the previous receptor binding domain, because the vaccine is made to recognize this domain. But they can no longer neutralize the virus because the virus is now entering into the cell using a domain on the virus that is not blocked by these antibodies, because these antibodies recognize only the previous receptor binding domain. So then you have a situation where, first of all, you have the virus that is tightly bound by antibodies that cannot neutralize the virus. This is a textbook example of how you induce antibody-dependent enhancement. Because for antibody-dependent enhancement, all you need is strong binding of antibodies, of multiple antibodies that cannot neutralize the virus. And so because they bind and strongly bind to the virus, first of all, you can forget about your innate immunity. It's completely outcompeted because these new anti-micron antibodies will strongly bind to the virus. You can forget about your adaptive immunity, so the vaccinal antibodies, because they bind to a domain of the virus that is no longer relevant for viral entry. And you have antibody-dependent enhancement, which in fact equals an increased level of virulence of the virus. So the virulence genes don't need to be changed, but the fact that the virus is now coated with these antibodies that enhance entry and the pathogenesis of the disease is in fact, it seems or it looks like the virulence of the virus would have increased. Because remember, if you normally recover from the virus or from the disease, what happens? The virus will infect you, it will break through your innate immune defense, and then it will start to do damage in your body. But in the meantime, you are building acquired immunity, naturally acquired antibodies that will still arrive in time to abrogate the infection so that you can recover. But if now this process, the pathogenesis, goes very, very fast due to the antibody-dependent enhancement of the disease, then the antibodies, the acquired immunity, cannot catch up in time and will not arrive in time to abrogate the infection, because you will speed up the pathogenesis of the disease, but you will not speed up the reaction of the immune system, of course. That is maintained, that remains like it has always been. And that is why I'm saying this is my fear. And that is why I've recently launched a second call. I don't do this very often, to the WHO, telling them, guys, if there is one thing you can really not do is recommend vaccination against Omicron. Even if Omicron is going to cause a little bit more of disease, it's possible. Frankly speaking, I expect we are going to have a little bit more disease. I don't think we'll have more death. Because why not? Because nevertheless, the vaccinees will have, because of the resistance, again, full access to their innate antibodies. It's just that in contrast to those who were not vaccinated and who got an opportunity to train their innate immune system, the vaccinees will end up with innate antibodies that got set free, but that have not been trained because they were blocked previously by the vaccinal antibodies. But nevertheless, they have again access to these innate antibodies, which is very, very important. So I think, yes, they could get more disease, maybe a little bit more of hospitalization, but I don't think this will be a wave of severe disease, let alone death. But I can tell you, as soon as the phenomenon that I think may happen, that Omicron will get a little or will cause a little bit more disease than it does right now, this will be petrol on the fire of these mass vaccination fanatics that will then say, oh, see, we need to have this anti-Omicron vaccine because otherwise, you know, the world is going to go crazy and people will die by the millions. Do you understand my reasoning?
Yes. So producing therefore a specific anti-Omicron vaccine that inhibits the receptor binding domain will actually cause the problem that it's trying to prevent. It will aggravate the problem that it is attempting to prevent.
Of course. Yes. I mean, for the virus, it's much easier to just insert one or two mutations outside of that receptor binding domain and to get access to another receptor on the cell, which it is already using, but not in a preferred way. Right now, it's still the AC2. And then it tells the vaccinal antibodies, you know, I don't care about you. You know, I leave you alone. You can attach to my previous receptor binding domain. Who cares? But that is exactly the phenomenon that is going to enhance the internalization of the virus and to speed up the pathogenesis of the disease. And where the problem is that the acquired immunity will not be able to catch up. The vaccinal antibodies, you can forget about this. They will outcompete your innate immunity. So there is nothing left, basically, in terms of defense against such a beast, right? Of course, those who don't get the anti-Omicron vaccine, they still can fully rely on their innate immunity. It's even trained, etc. And innate immunity can deal with all variants. It can even deal with all coronaviruses. So even if we have 2,000 other variants, I mean, for innate immunity, it does make a difference.
Right. So
thank you so much.
Yeah, thank you very much. I have a question in regards to the vaccination of children. As you know, Pfizer has a vaccine for the 12 to 18-year-olds, and now that they have a vaccine approved for the 5 to 11. Or what's the danger of trying to now mass vaccinate our children and also vaccinate them with this same Wuhan variant? You know, what impact will it have on the kids going forward? Especially seeing that they have not done sufficient testing, right? You know, for this. Why is that being pushed ahead?
Yeah. So, I mean, this is, of course, the biggest nightmare ever. So let me first say that, well, with regard of side effects, yeah, I mean, I always tend to refrain, you know, from elaborating on issues that I'm not a deep expert in. As you know, we are all very vulnerable, you know, so we can only, you know, get some credibility, at least with the larger public, when we speak about things that we are really deep experts in, because when we are countered, and that happens all the time, you're fact-checked, we can counter this, but it requires really deep expertise. But we know, and, you know, people like Peter McCullough and others are really deep experts in this, that the side effects in children can be really very problematic. If we only look, and this is only one aspect, for example, to myocarditis, for example, it's not negligible. I mean, it's not like, you know, this could be an accidental increase in cases. So the side effects are very, very problematic. But I'm always talking, and it's of course related, because what I will explain you is how the impact of this vaccine can interfere with the immune system in a way that, first of all, the vaccine is not efficacious, but not only that, that it also becomes a safety issue. So let's start from the beginning. Right now, they want to start vaccinating children. Same with the boost vaccination, the third boost. As we have already discussed, when Omicron will dominate, and that will probably be the case in the vast majority of the countries within a very short time frame, then, as we already discussed, Omicron is resistant to the vaccine. So you could say it is as if you would not even administer the vaccine because it's not going to have an effect. But what I think is that, nevertheless, they are pushing the current vaccines with the children because I think they want to say, you know, this is an obstacle. Many people, you know, are protesting against this. Parents are very, very worried about this. So it's a huge obstacle for the public authorities to convince people. But I think they prefer to fight this battle right now, even if it is about a vaccine that is no longer efficacious, because then when the anti-Omicron vaccine comes, it will already be kind of like standard policy that you vaccinate across all age groups, including the children. So that obstacle will have been taken already. But to your point, what is the problem with vaccinating children against, let's say, with a vaccine that would at least recognize the virus, for example, with an anti-Omicron vaccine? Well, first of all, the innate antibodies in children, they are very abundant and they can do a marvelous job. But there is one thing that these antibodies, that characterizes these antibodies, and that is that these antibodies are what we call in immunological terms, naive. They have not been trained at all. You have to imagine that if you train your innate immunity, you end up with antibodies that have a higher and higher affinity for the virus. So these naive antibodies in children that can do a fantastic job, they cannot stand competition from other antibodies that have higher affinity for the virus because they are so naive. So that means that especially the innate antibodies in children can be very heavily outcompeted by vaccinal antibodies. So that means that the suppression of relevant innate antibodies by vaccinal antibodies against Omicron is very, very substantial. And what that does mean is that, well, I have to start with why do we have innate antibodies? What is the evolutionary significance of this innate antibodies? Well, in fact, innate antibodies are to a large extent directed towards glycans. Glycans, sugars that have similarity with sugars on our own body cells. And why is this? Well, we know that cells are renewed all the time and there is degradation and degeneration of cells, etc. So the immune system has established a kind of system that recognizes this altered cell components that are no longer completely self, but that are self-like because they are degenerated or they are degraded, so they are altered. And if they would not be recognized in time and completely eliminated from the body, this could lead to recognition by, the adaptive immune system and lead to autoimmunity. So we have these innate antibodies to clear this debris that has structures that are self-like because they are degenerated, but they are no longer identical to self. But they are not completely foreign either. So they cannot yet be recognized by the conventional immune system. So these innate antibodies recognize self-like components of our body, primarily, for example, glycans. And these glycans also figure, as I explained, on the surface of viruses, etc. But what this means is when you are going to suppress these self-like antibodies, the cells that produce these self-like antibodies, these innate antibodies, then you are, of course, at risk of inducing a series of autoimmune diseases because you take away this natural system that prevents autoimmunity from developing by clearing in time components that have been your own body components that have been degraded or that have been degenerated and that are no longer completely self, that are self-like. So that is a major issue. And some experts, it's not only myself, but other people as well, other scientists as well, are warning against a kind of tsunami of autoimmune diseases that vaccination of children would or could provoke. Also, as I was saying, these antibodies not only prevent against all the variants or protect against all the variants of SARS-CoV-2, but even against all coronaviruses, common colds, etc., but even against most likely influenza virus, maybe even RSV. So the likelihood that we are going to see a higher incidence of infections that normally only infect infants or children, but that don't make them ill, the likelihood that these infections are now going to be turned into real childhood diseases becomes also very high when we immunize them. And in fact, it doesn't make any sense because the children have the best, innate immune system ever, and they can completely clear the virus. So there is no reason, absolutely no reason to vaccinate them. When we see that children get the disease right now, most of them, the vast majority, only develop mild, maybe moderate disease. They're for a number of days in bed. What is the reason? The reason is not because their innate immunity, or for that matter, any kind of their immunity, any sort, does not work very well. It is because their innate immune system is suppressed by the high infectious pressure, because highly infectious variants are circulating. And that high infectious pressure is due to our mass vaccination. So
Yes.
the problem, if we don't like, of course, we don't like to see children getting the disease, we should not be vaccinating them. We should be reducing the infectious pressure in the population. So we should stop mass vaccination, and we should reduce the level of infectious pressure in the population by the kind of measures that I have been explaining to your colleague, right? Namely, for example, antiviral chemoprophylaxis. So it's important to understand the logics and the sequence, because otherwise, you know, and that is so difficult for people. That is our frustration. The frustration of all the experts that are going against this is that it is so difficult to explain this to people in a way that they can understand this, that they can, for example, understand, oh, true, the real reason why my child may be at risk now of getting disease, where that was not the case at the beginning of the pandemic, is because this infectious pressure in the population is mounting ever higher, you know, from alpha, beta, delta, gamma, now Omicron. It's not because there is anything wrong with their immune system. They have the best immune system ever. And we need to keep that immune system intact. And when we are going to immunize this, we are just going to compromise their innate immunity with a high risk of dramatic consequences. I hope that it answers your question.
Yeah, Doctor, let me just ask one quick question before I turn back to Sherwin and Dr. McDowell. One of the things I consistently hear you say or speak to is mass vaccination. And so that those that are listening to us, because you did mention, I believe at the beginning, that you're not an anti-vaxxer. And I believe in terms of the information, it's clear that you're not an anti-vaxxer. And it would seem to suggest that you're not necessarily advocating no vaccination, period, but that your vaccination strategy should be more targeted to particular demographics of the society and so on. Would I be correct in expressing it that way, sir?
Yeah, I would say at the beginning of the pandemic, you would certainly be correct. Why am I saying this? Well, at the beginning of the pandemic, we had the Wuhan strain was, you know, low infectivity. It might have made sense, like we are doing for influenza. I explain all the time, it's a similar situation. We would have vaccinated or could have vaccinated the vulnerable people with underlying diseases, elderly people, especially in situations where they are at higher risk because you have a crowding effect, for example. We have not been talking about this. For example, in elderly homes, you have the crowding effect, which is very, very important, right? So we could have done this. Now, what is happening right now? So right now, I'm saying that even vaccinating vulnerable people it would be a huge mistake, because what we have is that, first of all, we are already dealing with high infectious variants. So we are already dealing with a situation where the vaccinal antibodies do not recognize well the circulating variant. And if we are now vaccinating these people or even boosting them, what will happen is that these people have already, for example, antibodies because the highly infectious variants are circulating. And when we boost them, we will even increase this infection, the immune pressure. But at the same time, so while we are increasing this immune pressure, these people are continuously exposed to the virus. So that is not the case, remember, at the beginning of the pandemic, where the infectious pressure was low. So you could still have a situation where you would vaccinate, for example, an elderly home, and where people would have the opportunity to develop full-fledged immunity after 1, 2, maybe 3 injections before encountering the virus, right?
Yes.
So in that way, you don't put immune pressure on the virus. But now we have I cannot emphasize enough that you cannot avoid being continuously exposed to Omicron, for example, right? And during that continuous attack from Omicron, from a highly infectious variant, you are now immunizing these people. So they are mounting their antibodies or boosting them while being exposed to the virus. Maybe not all of them, but the vast majority. The vast majority will, during the process where they boost their antibodies, or during the process where they mount antibodies during their primary vaccination, they will encounter the virus, the vast majority. So that means that you are raising an immune response in the presence of the virus, and that is exactly what drives immune escape. That is always, the parallel that I'm drawing, that I'm saying, this is like first going to the battlefield, and once you arrive at the battlefield, then you start loading your gun, loading your weapon. But you are already under attack. You should load your weapon before you go to the battlefield, right?
That's it.
If you only start loading your gun when you arrived already at the battlefield, I mean, before it is fully loaded, you will already, be fully under attack from the enemy. So at this very moment in time of the pandemic, it doesn't make sense, not even to vaccinate the elderly or the vulnerable groups. Whereas I agree with you, at the beginning of the pandemic, yes, and we should have done it fast, and we should have done really the most vulnerable people and those who are on top, at risk of being exposed to high infectious pressure because of crowding effect, like in elderly homes, etc.
Excellent question, Dr. Nichols, and excellent response, Dr. Vanden Bossche. And I want to re-emphasize that Dr. Vanden Bossche is continually saying mass vaccination at a time of high infectious pressure is what he's absolutely against. And let me take a walk on the wild side and go down a little rabbit trail. Sherwin, in connection with myself and Dr. Nichols, we have been able to mount a number of platforms where we have had some of the experts, Dr. Peter McCullough, Dr. Paul Alexander, Professor Dolores Cahill, people from all around the world who have significantly contributed, and now someone of your level and expertise, Dr. Vanden Bossche. My question is this: I have heard talk of a psychological process or psychological condition called mass formation psychosis. And it seems to indicate that all the truth that we are trying to release and all the wonderful information that we are sharing are falling on deaf ears, because many people who are under mass formation psychosis are under a type of hypnosis, and therefore they're not hearing our message. I myself have had some encounters with friends and family that shows me the level or the depth of the emotional and mental strongholds that hold people in grip from hearing our truth. They want to literally akin in the Caribbean to what we say, children putting sticks in their ears and breaking them so that they don't hear anything you say. My question, I know this is outside of your normal area of expertise, but I know that we all share a common humanity. My question is, how do we break this mass formation psychosis? How do we break this spell? I know we must continue to speak the truth, but how do we break the spell? Just quickly.
Well, my short answer would be, in fact, a recommendation is that you try to invite a country fellow of mine, Matthias de Smet. He's the one.
The guy?
Yeah, this whole analysis comes from Matthias, and people are mentioning his name and his theory worldwide because it is really completely applicable to what we are seeing. And it is a very, very scary phenomenon. So you have the phenomenon and the evolution of the virus itself, but then you have the evolution of this mass psychosis, which is just, accumulating and just exploding. It is a huge problem. Well, I've no solution to that either, but my answer is we have managed to disconnect from that at a small scale, the scale of my family, relatives, and friends. So first of all, we know, because we have the scientific background, that from a health viewpoint, from an individual health viewpoint, we are doing the right thing to protect ourselves, right? So people like me and others who are not vaccinated, you know, we are no longer bothering about our health. The thing that is worrying us is, of course, all the restrictions and the limitations that we're facing. But then we also say, well, first of all, it's so important. It's so important because everybody, as you were pointing out, is losing friends. But, you know, you can also make new friends. Of course, for people like me and others who are a little bit in the spotlight, it's easy. I mean, like Matthias de Smet, I didn't know him. He's a country fellow of mine. I mean, we got to know each other, and because all people are on the same level and have the same philosophy. I mean, you make friends pretty fast and pretty easily. But that is very, very important. People should create within this very strange and surrealistic environment that we are in and world that we are in, their own environment where they feel comfortable with people who think like themselves, and you know, that they feel, you know, that they simply feel good with, and should, of course, you know, should fight for their health. I mean, it's not, I'm never calling for protests and things like this, but it is true that when people find each other and fight for the same cause, and it's not fighting against somebody, it's fighting really for their health. And, you know, we now have all this, according to Matthias, peaceful protests. Peaceful is very, very powerful, peaceful. Because a peaceful protest, I mean, the opponent doesn't know what to do. If you use violence, they know what to do. That's what they're looking for. Then, but yeah, we are trying to disconnect from this by generating our own niche and our own community, so to say, and not being discriminating people. I mean, we are certainly not discriminating vaccinees. On the contrary, I mean, my heart goes out to these people because most of them thought they had taken the right decision, and so I would do whatever I can also to help them. But yeah, it's a very difficult topic, and again, I mean, you should really listen to the very wise words. I mean, everybody has his field of expertise, and this is really Matthias' field of expertise. I know he's, you know, people ask, you know, all over the world, they're trying to get him on podcasts and interviews on this mass psychosis. I mean, it is, people are just, because it can go very far. And I always, and I told him, I think, you know, people will wake up when their kids will be vaccinated, and they will see, for example, that there are, you know, case fatality rates in the children population are gonna rise, etc. He said even that if this mass psychosis continues like it's now the case, then people, you know, you could even bring people to a level that they accept that some of the children will die or will, you know, have, you know, permanent damage, right? So it goes that far, and that was new to me, because I would always think, you know, when something happens to the children, then the parents and massively the population will wake up. He was saying it's not necessarily the case, right? So it's he's very worried, actually. It's not like he has a clear-cut solution to this, but knowing what is going on and understanding the phenomenon that he's explaining, that in its own right can help you as well. It helped me. It helped me so that I could take a little bit of distance from this and say, okay, this is what the herd is doing. That is the groupthink and the mentality, and that is what I'm doing, right? And or what we are doing, and we are starting to organize again in smaller circles, cultural events, and all these type of things. It's a time for creativity. Some people say, yeah, we can't do anything anymore, and this is the end of the world, etc., etc. No, I mean, I lived for a long time in Berlin, and I was there when the wall came down, right? And so I had an opportunity to get a deep insight into how these people in East Berlin and in East Germany were living. And the level of inventiveness and innovation that they had in trying ways to fly, to leave the country and etc. Through the water, the air, land, etc. It was, with nothing, because they had access, to barely anything. They were fabricating engines and all these type of things, right? So it's a time for creativity, for innovation, and people need to socialize. So of course, isolating themselves is the worst thing ever, and it just is very, very disturbing. As see, as your colleague was saying, suicidal rates, suicides, and all these things going up. It's just young people, right? Young people. And my children are still in their 20s. And of course, I can give them lots of support and etc. But if they are not well surrounded and supported, I mean, this is a very difficult time in their life, because in contrast to young children at that age, they start to analyze what's going on in the world, and they try to digest the information and beginning to shape their lives. And it's all full of uncertainty and negative influences. So I can understand that this is really dramatic. And by the way, that's the reason why I'm doing it. I'm doing this for the next generation. I'm not doing this for myself, or I'm just doing this because this next generation doesn't deserve this. It's just awful. It's just awful. I can't stand it, what they are experiencing, because of failures that are made by people in our ages, right?
Are you in touch yourself? Are you yourself in touch with Dr. Matthias Desmet?
Yeah, and we got to know each other. As I was saying, of course we live in the same country. Belgium is a very small country. He's Flemish as well, and somebody had the idea to bring us together. And it is because we are fighting for the same cause, and we feel exactly the same. And then you meet somebody. We spent a full afternoon together, but it's like we have known each other for decades, right? It's such, a very close and intimate friendship. So normally I would say, well, I got to see him just an afternoon. I don't know him very well, but it was very, very intense. And we exchanged lots and lots of information. And it's... this is the beauty of the friendships that we make right now. The nature thereof and the intensity is it's not comparable to how we used to build relationships in the past. Yeah. Yes.
Well, if at all possible, maybe sometime in the future, if things can develop and work out, it'll be wonderful to have Matthias Desmet on a podcast or a broadcast.
Sure.
Yes.
Yes, I think that would be marvelous. One of the things that I've observed, Doctor, is that we, through the vast information that we have on the internet, we will always find persons who are objectional to everything that's put forward, and they will always cite their studies and so on. And one of the things I found very, very helpful is when we have persons such as yourself who can cite studies that you would have referred to or you would have been involved in, that we can equally refer persons to, because we find that inevitably objectors, if you want to put it that way, and for whatever reason, I don't know why persons are always hell-bent on trying to discredit other persons. I'm always one to say, look, let me hear what you have to say. Let me examine it, bring the facts. Let me look at the facts and let me see, and let's compare facts. And, there are times that I'm tempted to say, okay, let's get someone on like Dr. Vanden Bossche, and let's get one of the objectors on, and let's have it out and let the world view it. so that the world can make an assessment of their own, because this, as I mentioned earlier, is one of the great challenges that we have. You know, you hear one thing from this side, you hear something else from this side, and persons always tend to suggest that, you know, this thing is speculative, you don't have the evidence to do this. And I must be very brutally frank with you. I would have my doubts that Dr. Vanden Bossche would make statements at this time in his life, placing his profession, his credibility and integrity on the line without having substantive evidence. And that alone would satisfy myself. I mean, you are a world-renowned individual. You are a person who has been affiliated with the World Health Organization, from what I heard Dr. McDowell indicate. I would have my doubts that that the Bill and Melinda Foundation would involve a person who would not be credible and would not have some substantive knowledge, because there are those who are very insultive. I remember Dr. McDowell, when we started to talk about ivermectin, there was the whole matter of it being a veterinarian medication, and we had to fight just to get people to see that it was not. You know, and these are the kind of things that I really have appreciated Dr. McDowell and Sherwin helping us to provide the platforms where we could hear persons such as yourself speak directly to the issues yourself. So we really want to thank you for the time that you spent with us, and I deeply appreciate it.
Thank you so much. You're very welcome. But to your audience, I mean, people, first of all, because we are fact-checked all the time, but when people speak up and when they hear things, the first thing they should do is to look whether these people have a conflict of interest. I mean, people
absolutely.
People like myself, like Peter McCullough, like Robert Malone, we don't have any conflict of interest. We are independent. That is so important. And of course, I mean, I was telling you, this is also important to understand. This is a puzzle that has been put together for the very first time. I consider that I have put this puzzle together for the very first time. Now, when you look at the puzzle, each piece of the puzzle, you can criticize each piece of the puzzle in isolation or separately, because a piece of the puzzle can only have its value within the context of the full puzzle.
Correct.
So what people do, they rip out pieces of the puzzle and then they start to criticize this, not looking at the context within which you have put this piece of the puzzle. And then, of course, since it is the first time you put this puzzle together, there is some kind of speculation. But that is why I'm saying you build a working hypothesis and you say, well, that is my understanding, and I think that is going to happen. And then you look what is happening. And if after multiple occasions you see that, and these are the predictions, that the predictions come true, like I've been saying, we will just breed more and more infectious variants, for example, then I'm not saying that your model is completely validated, but as a working hypothesis, it helps and it informs and it can stimulate people and motivate people to start thinking about possible solutions, etc. Because what I'm always saying, people say, yeah, where are your publications? And have you published this, etc. But there is simply no single publication that would even, indicate that, for example, mass vaccination with this type of vaccines in the midst of a pandemic could ever have a happy end. There is no single publication, but they are criticizing us that we don't have publications. We are trying to solve a problem. We are not interested in publishing one or the other aspect. We are interested in solving a problem. That is different from taking a deep dive in publications and teasing out all the different details and concentrating on one piece of the puzzle and criticizing you. That piece of the puzzle has only significance or is only meaningful if you look at the full context. And that is an exercise that people from academia are not used to do, because you're a top professor in virology and you have all the papers on certain molecular aspects of the virus, right? And then I'm saying, show me the publications that have ever solved a global health problem. There are none. The publications in their own right, they're very important, but they are nothing else than pieces of a puzzle if you want to solve a problem, right? And if people would get to understand this, that it is so important that people, of course, come with scientifically plausible arguments. One, that they invite their peers for a discussion, for an open debate. That is two, that they have no conflict of interest, right? I think it would help them tremendously in what I call separating the wheat from the chaff, right? And you know, finding the information that has a certain level of credibility that at least is helpful for them, rather than being confused by conspiracy theories or confused by, you know, top-level professors that are criticizing us because we have no proof of the exact molecular mechanism on how ivermectin works, for example, right? This is ridiculous. But yeah, that's how life is. Anyway, thank you so much. I much enjoyed, you know, learning to know you, and very, very interesting questions. I much appreciate it. I can see and hear that you well prepared for this, and yeah, it has been a joy despite all the difficult times. So let me just, you know, take a few seconds to wish you a prosperous and a healthy and also a peaceful new year, and hopefully we'll hear from each other next year.
Yes.
Well,
yeah.
Thank you so much. Yeah.
Yes, thank you so much. And we wish you a blessed and prosperous and successful new year.
Yes, I want to thank you as well. Dr. Vanden Bossche, by chance, do you have 5 more minutes? I'm going to stop the live now.
5 minutes, yeah. Because they're preparing meal and I joined it.
So what I'm going to do, I'm going to stop the live. I want to introduce you to our Clubhouse crew, but the live is going to stop now. And